Hello everyone, this is Dr. Bob Ranner with update number 14. The theme today is the plan is ready for reopening, but when is anybody going to read it? So my most frustrating comments that I hear are, who could have predicted this? Well, everybody's been predicting this in the public health community for decades now, actually, and there are playbooks that have been written and rewritten, and several people have been releasing Cliff's Notes versions of them, including this one released a little over about a week ago. It's the guidance for the governors. I just hope a governor would read it. So again, Tom Frieden, these are people from past administrations. The last one was from a Republican administration. This is Tom Frieden from a Democratic administration saying, here's the playbook, please look at it, please follow this. Yet nobody seems to be following these playbooks. It reminds me of one of my favorite quotes from Winston Churchill. You can always count on Americans to do the right thing after they've tried everything else. Please, are we done trying everything else? Because we do know what the playbook is and we do know what the right thing is. Let's start doing it. One of the problems I think is people picking and choosing modelings based on their political beliefs. Both of these models I think are flat wrong. The 50 to 180 deaths in Nebraska, that was based on old information, which is now no longer true. And then the other one here, this is actually came out just this morning. This is based on a model that's already not true. And this is this morning's headline. Basically, I would say that this old model was based on how we were doing in Nebraska, not how we're doing right now. Best case scenario, and I'd be willing to bet any public health official in Nebraska $10,000 that this is wrong, and that if anything, this is right for Grand Island. It may even be right for Crete and Lexington. I hope that's not the case, but it might be. This 66,000 that came out this morning, this is going to be wrong in 10 more days if we continued our current trajectory. So I don't know why people are still looking at this model when it appears to be that far off already. I think people are stuck in models because they want to believe them, not because they're looking at the numbers. So again, all models are wrong, some are useful, and there's good articles about what you have to think about when you look at a model and knowing when to revise your model based on current information. So the old model of UNMC, I think, was based on back when we were doing what we were doing here. We were doing a good job in Nebraska. The university closed on a timely basis. We had no spectators at the state games. Omaha Public Schools, Lincoln Public Schools, they closed when they were supposed to ahead of New York. We were doing the right thing, and so we were on a good trajectory. Unfortunately, we blew it with the meat processing facilities. First Grand Island and Lexington, and now probably Crete. So we were doing well. We're not anymore. So it's people realize that we need to readjust based on what's happening on the ground. We don't make the decisions. Coronavirus makes the decisions. And if you look at this side, I think it seems pretty reputable. They're looking at the infection rate and how it's going. Red means it's going up. Green means you're probably getting on top of things. You'll see Nebraska way over here. And again, what happened was we blew it with the meatpacking facilities and our delays in doing anything about it. Weeks ago, this was almost 3 weeks ago, that the docs in Grand Island had to write an op-ed in the Omaha World Herald to get something done. A week or two ago, it was Lexington and Dawson County. Again, the primary care doctors saw it coming, had to reach out to people across the state to get anybody to pay attention. The frustrating thing to me is the people not at the table in Nebraska right now are the physicians community. All of them are writing op-eds in the paper. Libby Crockett and Rebecca Steinke in Grand Island, Dr. Sean Jobst here in Lincoln, because we can't get anybody to pay attention. We're seeing it happening in our clinics right now, but we cannot get any of the health departments or the political leaders to pay attention to what we're seeing. Most recently in Crete, Josue Gutierrez down in Crete and myself have been saying this for 10 days now. Watch out for Crete. It might be the next hot spot. It's looking like it's going to be the next hot spot because nobody will pay attention and do anything about it. So it's very frustrating to me. I get what people's frustrations are, and I think the problem is you have half the camp over here sometimes over freaking out about COVID-19. The other half over here worried more about government overreach and economics and completely ignored COVID-19. We need to be in the middle. We need to keep all three of these things in mind. To do this effectively, we need government to rediscover its role as neutral convener, not decider of big decisions behind closed doors with incomplete information, which is what's been happening now at pretty much every level. So we need government as a neutral convener. That means one, you have to convene, which hasn't happened, and two, when you do convene, you have to be neutral. That also, what little convening has happened has not been anything like neutral. There are going to be some really tough decisions coming up in the next couple months, and these are really hard ethical decisions. To make these ethical decisions, you really need an open and transparent process. They need to be bipartisan because they're going to be hard, and if you make this unilaterally, the political blowback could be the type of blowback that brings down governments. This needs to be an open and transparent process, and that's why the guide that was just released. They're trying to point that out. You need to make these decisions based on good numbers, not behind closed doors, not in in secret. My biggest worry right now is at the federal level, it's already been decided they're going to sacrifice hundreds of thousands of Americans without a bipartisan consensus. I'm worried that the state level that decision may have been made to sacrifice thousands of Nebraskans without political consensus. We need to not have that happen. And so the public health playbook pushed out. This is a former Republican administration official plus experts at Johns Hopkins saying this is why decisions pertaining to opening must be nonpartisan. They need to have all stakeholders. They need to consider all circumstances. They need to bring in diverse perspectives so they can make the right decisions. There are lots of practical things that you need to know, and if you're not talking to the right people, you're going to make the wrong decision. You also need to make sure that all communities are involved and that people aren't kept in the dark. One of my biggest frustrations is the scapegoating happening around Grand Island right now. I pulled this off of Facebook. I think Amy Dickerson was totally correct that trying to blame folks on the quinceanera, that happened on the 14th, the day after the March 13th emergency declaration. There was not enough time for the community to learn what was going on. And plus, if they were to look around them, they would have seen politicians still denying the issue. They would have seen their plant managers making no changes whatsoever. What would have clued them into the take that this was a big problem? There was not a Spanish language version officially pushed out to almost a month, well, more than a month later. The only Spanish language stuff I'm aware of was being pushed out by the Grand Island Health Department and Dr. Josue Gutierrez in Crete. So they were trying to do this after the fact, but to blame those is completely wrong, and it's scapegoating it, and it needs to stop. So communication is really, really important around reopening. That's, again, another topic of this playbook is you have to make sure that people understand why we're doing this, the decisions behind it. We need to be honest about the uncertainty. There is not certainty about these decisions, and you're going to have to make changes, and you need to know what are the factors that might lead you to change your recommendations. People need to look at those numbers. The good news is the numbers are out there. It just does not appear that anybody's making decisions based on those numbers. Another thing is that there needs to be two-way communication. So what little communication has happened in Lincoln, Nebraska that I've been on, they've muted us so none of us physicians can talk, and we can only submit chat comments, but they're censored by a health department official. So there's not two-way communication happening in Lincoln. It needs to start happening. So the problem is essentially we had an opportunity to have our fatality rate end up like this. We blew it. We now are headed toward a fatality rate looking like this, and if we can keep getting it wrong, we may have a fatality rate in Lincoln and in the state of Nebraska more like this. So let's hope we don't keep getting it wrong. We lost our opportunity to be here. Let's not get us all the way to here or even over to here. Again, we're going to have the government start rediscovering its neutral convener role. So why I think those numbers are wrong, the 50 to 180 was based on old information. I think just North Platte or just Grand Island alone will be at that 50 to 180. And that's based not on a predictive model, but looking at what already happened in New York. So if you look at New York, they've already had 15,000 deaths. The percentage of their population that has died is already at 0.18%. That is actually 110 deaths for Grand Island potentially. That's already that whole state average. So that's why I'm very confident that I would bet any public official $10,000 that UNM study was wrong. At best, it's the numbers for Grand Island. The other worrisome thing is these deaths in New York City, they're still going up. So the ultimate number could be 2 to 3 times that potentially. So that's where we could be if we keep getting it wrong. And that's why, unfortunately, Crete and Lexington could even hit that 50 to 180. That's why we need to start doing things right, start paying attention, and start looking at these numbers and making decisions based on the numbers, not based on our politics. So government needs to act as a neutral veneer. We need to start bringing folks together. This is if you look at the history of hundreds of years of epidemics, there are multiple waves. Hopefully this will be the big wave and not a bigger wave here. We could, if we get this wrong, by closing and doing the right thing and then reopening too soon, we could actually get a bigger wave that's even worse. That's why the monitoring system in the place needs to be built before we even talk about opening, to be honest with you. So we already know that we're on that way up. We're still on the way up. So the talk about reopening right now is very much premature. I can tell you that none of the discussions that need to happen have happened yet as far as having something in place when we reopen. So to run to reopen, again, this is based on the last one I've been echoing for weeks now. We need to be able to test everybody. We could be getting there in the next few weeks, although the testing we have is very disorganized and there does not to be a comprehensive plan or a communication plan around it. Once it's built, we have to see it go down for 14 days. So we're not even ready to have that first 14 days start. So it's way premature to be talking about opening at this point. Hospitals have to be ready. I do think they have enough stuff in place from an equipment and personal protective equipment, but the clinics are not. The clinics still do not have enough protective equipment, and the state seems to have forgotten about them. And then the state, once we're ready, we have to have a way to monitor our contacts. This is going to require primary care doctors and I think school nurses. So they're putting out a call for public health people. You have a lot of public health people already embedded in communities. They're called school nurses. Why aren't we involving the School Nurse Association, for example? So the two of the most important people have not been brought to the table yet. To make this work, we need a three-legged school. We need public health departments to start working with primary care clinics and to start working with the schools, preferably the school nurses. This stuff needs to happen, but that's going to take some political leadership to get all these folks to the table. What we want to avoid, like I've shown before, this is history. New York is looking like Philadelphia. We had a chance to be Minneapolis. I think we may, unfortunately not, but we still have the opportunity. I think that we can still act like that if we don't wait too late. I like this. I understand that there are concerns from the economic perspective. My biggest concern actually is our school kids. I was on a call recently where a significant number of low-income kids have sort of basically just been lost to follow-up. We don't know if they're okay. We have no way to monitor them. That is my biggest worry. Well, I am worried about the number of deaths that we can have, but I also worry about the long-term consequences of low-income kids whose families are desperate, the kids aren't getting educated. We can make this work for a couple months, but if we get into the fall, we may have to open back up again regardless, because the consequences there could be just as bad. These are going to be tough decisions, but we need to have these in an open and planned and a transparent manner. The other reason we need to slow these things down is we actually do have some potential treatments on the horizon. This convalescent plasma, I think, has the most likely opportunity to work. There are studies are already ongoing, and the first patient in Lincoln has already received this possible treatment. This could be a game changer. So if we can slow down our spread for a couple more months even, we may actually have a game-changing thing that would limit and prevent a lot of those deaths, but we have to not open prematurely so that we have an opportunity to develop these treatments, because I do think they're possible and they could come online within months. So hopefully this is helpful to you. This may be more frustrating and a little more politically charged than last ones, but these are things we need to talk about. I run into this in all of my jobs. With the clinics I run with, they're all frustrated right now. The public health, we work a lot with health disparities in our low-income communities. They're hurting right now. The schools, we have a lot we're worried about, trying to figure out how do we contact all these missing kids. Is there anybody checking out on them? These are huge concerns, but we need to have a more open and transparent way of talking about this. Hopefully, I do see some hope of this happening in Lincoln and Lancaster County in the next week or so. I hope something will happen in the next state in the next few weeks. So what I need from you right now is you guys need to start calling your elected officials and start getting them opening back up and talking about serving their neutral convener role.